Dr Scott Arthur.
Thank you, Chair, and it's a pleasure serving under you today on the last day before recess. And I want to thank my honourable friend from Dumfriesshire, Clydesdale and Tweeddale for bringing this debate to us. And I think him opening the debate as a reminder that HIV isn't just an issue in our big urban centres. In October, I visited Waverley Care's headquarters in Firhill in my constituency of Edinburgh South West and was deeply impressed by their work. Established in the 1980s, Waverley Care bravely opened the UK's first purpose-built AIDS hospice, Milestone House, responding to the then emerging HIV/AIDS epidemic in Edinburgh. Milestone House faced initial opposition, reflecting the fear and stigma surrounding HIV/AIDS at the time, which we've heard about. And I've heard first-hand accounts of this, including from a former Firhill High School pupil who recalled visits to the centre and the subsequent backlash in the media. Work placements had to be ended due to this misleading reporting. And it pains me that, back then, some of the LGBT community found that hate as a barrier to seeking help and also seeking testing. And it really pains me that today some of the trans community face the same bigotry, and it's a barrier for them seeking testing and also seeking PrEP. We must acknowledge the courage of individuals at the time, though, and I want to include in that Councillor John Allen, who represented Oxgang's ward. And he wanted it to come to his ward when other councillors were doing all they can to stop it coming to them. So I want to thank him for his leadership. The turning point in terms of opposition to the centre locally came when Princess Diana visited. And she visited many hospices. Her simple act of sharing a cup of tea with a visibly ill young woman sent a clear signal. The patients faced death, but they were still people and were still worthy of our respect. And I don't compare the Prime Minister to Princess Diana, of course, but what he did this week is exactly the same. Just as all of us tested this week as well, and are telling our constituents about this, we're all doing exactly the same. Although it was harder to get blood out my finger than I expected, I have to say. Since then, remarkable medical advances have transformed HIV/AIDS from a death sentence to a manageable condition. And Milestone House is no longer a hospice. However, as was highlighted by the member for Dumfriesshire, Clydesdale and Tweeddale, the fight is not over. Shamefully, and I say shamefully, HIV testing in Scotland has decreased by 19% since 2019, and diagnoses are on the rise. Scotland lags behind England, lacking a dedicated HIV testing week and opt-out testing in our high-risk urban centres. The prevalence of HIV in Glasgow and Edinburgh is over double the trigger level for opt-out testing in England, but yet that facility is not provided. Waverley Care rightly highlights that whilst LGBT community has strong awareness, heterosexual transmission is now the most common route, often due to lower testing rates. This is why dedicated testing week and opt-out testing are so important in Scotland. Waverley Care, in partnership with THD, is leading the charge for opt-out testing and an HIV testing week in Scotland, and they've written to the Scottish Government. And I'll come back to that, I think. These measures have been proven to be effective in England. Having read the testament from Waverley Care and Terence Trigger's Trust, I cannot see how Scotland can meet its target of no transmissions by 2030. It just cannot be done. And I also can only conclude that it's going to make it much harder for the UK Government to hit its own target. I would therefore like to ask the Minister if she will write to the Scottish Government, making clear the benefits of an HIV testing week and making clear the benefits of opt-out testing in our big urban centres, and asking them to follow the UK Government. Thank you.
Liberal Democrat spokesperson.